In this last section, we are going to talk about common cardiovascular medications and considerations for physical therapist assistance. There's that activity in the book, which it's fun to do. Um, it has a bunch of medications listed, and it says, is it an ACE inhibitor, a beta blocker, a diuretic, or a calcium channel blocker? And you drag it over to the one you think it is. And I'll tell you how to tell them apart by their names. So the learning objectives are to be able to identify common cardiovascular medications and their mechanisms briefly. You don't need to write out the chemical formulas or anything. Recognize medication side effects that are relevant to PT practice. And this is the sort of thing that will show up on board exam questions, is what are the side effects that are relevant to PTA practice? Understanding PTA considerations for cardiovascular conditions and appropriate safety measures and monitoring. So very important. So cardiovascular medication categories, there are a lot of blood pressure medications. The ACE inhibitors that have a pril suffix, ARBs, angiotensin 2 receptor blockers, beta blockers that have an olol suffix, calcium blockers, diuretics, which tend to have an "ide" suffix, and we'll look at some different ones so you can get the idea. Other cardiovascular meds include anticoagulants to prevent clotting, antiplatelet agents, which reduce clot risk by reducing platelets, and with both of those, there's a risk for bleeding. Cholesterol-lowering medications like statins, digitalis preparations, which are often used to treat heart failure or arrhythmias, and they work on heart strength. Vasodilators open blood vessels, and immunosuppressive drugs are used for heart transplant patients. And if you recall from chapter 3, when we talked about the immune system, we talked about immunosuppressive drugs and what they're used for. So one of the primary blood pressure medications that is used, it's used for blood pressure and for heart failure. Angiotensin converting enzyme, or ACE inhibitors. So ACE inhibitors, common examples are lisinopril, enalapril, lisinopril. They end in pril or sometimes ill. So if you see the name of a drug that ends in pril, it's an ACE inhibitor. So ACE inhibitors inhibit enzymes that cause blood vessel constriction. So normally, when our kidneys detect that blood pressure is going down, they release renin, which goes to the liver and converts angiotensin 1 to angiotensin 2 using the angiotensin converting enzyme. And angiotensin 2 increases blood volume and increases blood pressure. So if you have an inhibitor of those ACE enzymes, it stops that increasing blood pressure cycle. So it inhibits those enzymes that cause blood vessel constriction. So you have a larger arterial lumen and it lowers blood pressure. So you get a decreased cardiac workload. So that's why it's used for hypertension and for heart failure. The key side effect is lightheadedness and potentially syncope or fainting, especially from rising from supine to sitting, so orthostatic hypotension. So move patients slowly between positions. Monitor for dizziness during transfers and ambulation. So if someone's going from supine and you're going to get up and walk, go supine to sit, wait, see if they have dizziness, wait till it dissipates. Then go from sitting to standing, wait, see if they have dizziness, and so on. So progress slowly and monitor for dizziness all the time because you don't want to risk fall. Angiotensin 2 receptor blockers, or ARBs, they're also used for the treatment of hypertension and heart failure. They block ACE receptors in the heart. So they're just another way in that renin angiotensin 2 pathway to keep the blood vessels from constricting and raising the blood pressure. So the common names, examples, they usually end in tan. So losartan, telmisartan, valsartan. So that tan, um, that's if you see those names, you're like, okay, that's probably an ARB. So it blocks ACE receptors in the heart and the blood vessels. So the ACE um, inhibitor actually blocks the conversion of angiotensin 1 into angiotensin 2. These block the reception of angiotensin 2 in the heart. So it's used for the same thing, same side effects, especially the syncope, especially position changes. So monitor for orthostatic hypotension and implement slow position changes. You're going to see that as a theme for blood pressure medications. So beta blockers, the generic names of beta blockers end in OLOL, OLOL. So metoprolol, propranolol, nadolol, and then so it has that's their generic name, and then it has the trade name of each of those. Inderal is a common one you see, or Lopressor. So it blocks the effects of epinephrine. So in order to increase our heart rate, the sympathetic nervous system says, oh, the heart rate needs to go up. I'm going to send epinephrine. It's going to bind to those beta receptors on the heart. And so beta blockers block the receptors. And so they block the effects of epinephrine. This causing a slower heart rate, decreased cardiac output, lower blood pressure, and lower heart contractility. So it's used for hypertension sometimes, cardiac arrhythmias, angina, and post myocardial infarction prevention. It's used preventatively post myocardial infarction. So same side effects as the other blood pressure medications: lightheadedness, dizziness, syncope with position changes. The other thing with beta blockers is the heart rate doesn't rise normally with exercise. So heart rate is not a reliable monitoring tool for exercise intensity. You need to teach your patient to use the rate of perceived exertion scales instead. That's really important for beta blockers. And I could see a question like that showing up, where patients on beta blockers, what do you need to do to monitor exercise intensity? That would be a good question. Calcium channel blockers are they block calcium from crossing cell membranes in the heart and blood vessels, which causes weaker heart pumping and more relaxed blood vessels. So the common examples, they usually add a lot of them end in pine, P-I-N-E. Some of them don't, though. Calcium blockers don't have as much consistency in naming as some of the other ones. But they're used for hypertension, chest pain, and cardiac arrhythmias. The side effects, same side effects. Are you seeing a theme here? Sometimes calcium channel blockers can worsen peripheral edema if somebody has it. So we're going to watch for edema and weight gain. We're going to document swelling changes and notify the supervising PT if it's worsening. How are we going to monitor our swelling? We're going to measure. We're going to measure in centimeters and we're going to write it down. So that's important. And we're also going to note whether the edema is pitting or non-pitting, and any other changes they see. And weight gain is a good monitoring thing. Diuretics, their generic names often end in IDE, like furosemide and chlorothiazide and hydrochlorothiazide. They help the body, they're diuretics, they help the body remove excess water and sodium from the blood in the interstitial spaces. So they're used for hypertension, heart failure, and body swelling and edema. Furosemide, its a trade name is Lasix, and it is far more commonly used for heart failure, right-sided heart failure in particular. Hydrochlorothiazide is more often used for hypertension. And it's actually one of the early interventions for hypertension that a lot of people, they try a lot of people on first. Same side effects. And you also, in addition to those same side effects, you also have a risk for dehydration and electrolyte imbalances because you're getting rid of sodium and water. There are diuretics that spare sodium and get rid of potassium. if someone is having trouble with low sodium when they're on diuretics, they can switch them to those other ones. Sometimes a side effect of a diuretic can be confusion, which may indicate a metabolic issue. So you want to watch for muscle cramping or weakness, and that indicates electrolyte depletion and a confused or altered mental status. That if you have low sodium or low potassium, you could have that altered mental status. So that's pretty serious. That's like emergency room, get admitted to ICU serious. So that's really something to be aware of with diuretics. So anticoagulants and antiplatelet agents. Anticoagulants are medications that decrease blood clotting so that clots are less likely to form or grow. They don't break up existing clots, so they're not like the clot busting drug that they use for when you're having a stroke, but they do help prevent clots from forming and slow the growth of thrombi if they exist. So anticoagulants are often used as preventative to help prevent coronary artery disease, stroke, heart attack, DVTs, or other conditions of the blood vessels. So the ones that you see a lot are heparin is often used if you have pulmonary embolisms or a DVT. Warfarin, Coumadin is used more prophylactically to prevent problems. So besides anticoagulants, there are also antiplatelet agents, which inhibit platelets. They make the platelets less sticky, so they don't stick to each other. So aspirin is one of them, and Plavix is another. That's the trade name of it. There are bleeding precautions with anticoagulants and antiplatelet agents, so you must avoid even small injuries. Excessive bleeding or hemorrhage is possible, internal or external. So use extra padding during transfers, monitor for bruising. GI upset could be a side effect of anticoagulants and antiplatelets, and long-term use could cause, there's a risk for liver toxicity. You're not going to see the signs of that right away, but the bleeding precautions, that's the major precaution for anticoagulants and antiplatelets. So some other cardiovascular medications, statins that lower cholesterol, they usually end in or they like the brand name ends in or and the generic name ends in statin. So avorstatin is Lipitor, you get the idea. So side effects can be headache, GI distress, a muscle pain, myalgia, or a skin rash. Digitalis preparations are called digoxin, digitoxin, lanoxin. So the oxin part, that's what clues you in. So they treat cardiac arrhythmias and heart failure, but they could also cause cardiac arrhythmias and GI distress and dizziness and blurred vision. So the idea of the digitalis preparations is they're supposed to increase heart muscle contraction. Vasodilators are usually used, they're nitrates, so nitroglycerin tablets. They're usually used in an emergency fashion to open blood vessels and relieve chest pain when someone has angina pectoris. Side effects could be lightheadedness, dizziness, syncope with position changes. Usually people are not taking nitroglycerin regularly. They're only taking it when they have the chest pain. And they usually carry it with them. So immunosuppressives, cyclosporine, prednisone, some of the other ones, they suppress the immune system. They could cause nausea, liver, kidney problems, and they're for heart transplant patients to prevent rejection of the new heart. So we've talked about all the signs of cardiac distress or cardiac pathology, and they are consistent throughout all the different pathologies. However, people can have individualized symptoms. Like with heart attack, women tend to have different symptoms from men. They don't have the classic crushing chest pain, diaphoresis, cyanosis, that sort of thing. They might feel anxiety or indigestion or lightheadedness. So if a patient exhibits any of the signs that we've talked about a zillion times now, get them in a safely supported position. So I was talking about my tall patient. And the first thing I did, because I didn't think it would be safe to walk him across the gym, is I got someone to bring over a chair, and I sat him down in a chair. And then I gave him water, I monitored his vitals, and I slowly moved him over to the table. Um, Request assistance. So that's what I did. I said, okay, it's going down. So right away, I called to one of my coworkers and said, hey, help me out here. If they're unresponsive, they need immediate medical attention. You need to call 911. Or if you're in an inpatient setting, you need to call a code. So that don't be afraid to ask for help. Asking for help is a sign of professional maturity, not of weakness. So always ask for help because safety is very important. So the side effects that are a priority for us are orthostatic hypertension, hypotension, which can be caused by ACE inhibitors, ARBs, beta blockers, calcium channel blockers, diuretics, or vasodilators. So most of the cardiac medications. And then bleeding risk caused by the anticoagulants and antiplatelet agents. So for orthostatic hypotension, we want to gradually, slowly move patients between positions. You really want to monitor that dizziness and lightheadedness during transfers. We want to educate patients how important it is for them to do slow transitions. A lot of people fall when they're jumping up to get the door, or jumping up to answer the phone, or jumping up to run to the bathroom. So really educate them how important it is for their safety to make slow transitions, and use gait belts and assistive devices as much as you need. For bleeding risks, you want to avoid even minor injuries. So even a scrape can bleed a lot. Use extra padding during transfers, monitor for bruising, and be gentle with handling. So beta blockers, we're not going to use our heart rate to monitor exertion. We're going to use rate of perceived exertion. I like the Borg 0 to 10 scale, even though it doesn't correspond to heart rate. But the Borg 6 to 20. And, most clinics that I've worked at, they have the Borg scale posted like next to the cardiac equipment, right next to the treadmill, right next to the bike. So you could ask your patient, where are you on this scale? For patients that are on diuretics, watch for muscle cramping and weakness because that could be a sign of electrolyte issues, which can be very serious. For people who are on statins, you want to monitor them for muscle pain, myalgia, because that can be a serious side effect. And for all cardiovascular patients, you want to monitor their blood pressure and their symptoms during exercise. And a lot of them, you also want to measure their oxygen saturation. Post-surgically, if someone's had general cardiac surgery, there's wound care considerations, checking for signs of infection, avoid disturbing the surgical site. It might be tender. The sternal precautions are keeping your moves in the tube, like we say now. So imagine that you're in a tube and you keep your moves in the tube. So you want to avoid undue stress to the surgical area. Sometimes people with open heart surgery have difficulty with assistive devices. So part of what we can do is get them the correct assistive device, like a cardiac walker or something like that. And you want to be super careful with transfers and mobility. After surgery, deep breathing exercises, controlled coughing, using a pillow for chest and abdominal support, and preventing pulmonary complications are very important. For heart transplant patients, infection control is critical. Strict hand washing and strict PPE requirements, and they're usually enhanced precautions for a heart transplant patient. So when are we going to communicate with the healthcare team? Well, hopefully it's a all the time sort of thing. But if someone's having medication side effects that's affecting their well-being, their quality of life, being able to progress in PT or safety during treatment, that is a good thing to talk with the rest of the medical team about. So if they have excessive dizziness that's limiting their mobility, or new or worsening edema, or unusual fatigue and weakness, so kind of new symptoms, signs of bleeding or bruising, or confusion or mental status changes, communicate all that, because that is really important. And confusion or mental status changes in particular can be a very serious situation. Immediate medical attention for multiple cardiac symptoms simultaneously. So fatigue, shortness of breath, cyanosis, chest pain, etc. Loss of conscious, immediate medical situation. Severe chest pain, significant breathing difficulty or uncontrolled breathing. If your circulatory system isn't working, that is a medical emergency. We're going to document and we're going to record vital signs and document patient responses all the time. Free time. I want to see that in your SOAP notes when we're in special topics next year. I want to see that in your SOAP notes. You want to observe, note any medication effects observed during treatment, like orthostatic hypotension. You want to document patient education provided. So educated patient on the importance of slow transitions to avoid lightheadedness and dizziness causing falls. You want to report significant changes to your supervising PT. So if somebody has had a dramatic change in status, they might need a reevaluation. So here's our quick reference summary for the names of the drugs. So prils are ACE inhibitors, alols are beta blockers, IDEs are diuretics. You want to universally, with all of these cardiac medications, do slow position changes, monitor for dizziness, use gait belts and other safety devices, and document the patient's response. With high-risk medications include anticoagulants for the bleeding risk, beta blockers because you can't use heart rate to monitor exertion, and diuretics because of potential electrolyte issues. So we are going to monitor vital signs, recognize those symptoms early, recognize the patient's functional limitations, and patient safety always comes first, always. When in doubt, slow down, assess, and communicate with your supervising PT. So go to the textbook and take that little quiz on the different medications. It's fun. You know what I did is the ones that I knew I put in automatically. So I'm like, oh, Pril, that's an ACE inhibitor. Alol, that's a beta blocker. That's a diuretic. I put in as many as I could, and then I sort of guessed on the rest of them, and I got them all right. So yay. So you don't have to know everything. You just have to know a lot of things.